I actually started volunteering for Community of Hope Clinic in 2011. I had recently graduated from my master's degree from UAB, and I really wanted to be involved with something that was related to my career and also help the Hispanic community. So I found out about the clinic and I started volunteering then. After a few times coming to volunteer, I was actually offered a position.
I began working for the Community of Hope Health Clinic in May of 2015, so we'll be coming up on my 10 years this year. I began working for Community of Hope with the hopes that I would be able to grow the programs, grow the budget, and provide more services to the people of Shelby County who needed this type of help.
The Community of Hope Health Clinic is a free and charitable clinic that sees Shelby County adults who are at or below 200% of the federal poverty guidelines. They don't have access to private insurance or government help.
Aid services are offered by the clinic, including primary care, physical therapy, mental health, dermatology, prenatal, free medication, optometry, and mobile health.
So I started volunteering about 3 years ago. I was still a student, eager to learn, but I quickly realized that this place was so much more than just medicine.
The thing that impresses me is the quality of care that the uninsured patients are getting through this facility, and the staff is excellent. Just the other things, as well as the interpreters, for instance. Our interpreters are in person. So often you'll have an interpreter that's online with your phone, and it's very frustrating, but these interpreters are great. They're there and they're engaged with us as we engage with the patients. So that's fantastic.
Volunteering here has made me realize that access to medicine can transform lives, and that's what this clinic is about.
I would be in a very bad place if I was even alive, if it wasn't for Hope, really. I don't know. Yeah, I probably wouldn't be here. So, but I really appreciate it though.
I felt like there was so many possibilities that for us to grow. Having the opportunity to work with Justin, our executive director, really allowed for us to see that vision and put our ideas to work, to where now we are offering 8 services, and we've grown tremendously, not just because of our vision, but because of the needs that are in the community that we're constantly being made aware of, and we're constantly trying to think of ways of how can we serve, how can we improve, how can we grow, and how can we help.
We actually have 8 services we offer now, and when I tell people all the time about the 8 services, they're all, in shock about how much that we can do on such a small budget and such a small staff, and dealing just with volunteers. We've had hundreds of people that have come through this clinic, had eye exams. We've had probably close to 75 or 80 people that have gotten prescription glasses for free. It's just important to be able to be as all-inclusive and as comprehensive with healthcare as we can be in the Community of Hope.
It's amazing the care that the uninsured patients get here. I've worked for 40 years as a physician, and especially 23 years in urban Birmingham, working with uninsured as well as insured patients. And I've never had the services available that are available through this ministry.
Having the ability to have a medication dispenser here on site, which the patient can come to their visit, they can get their medication and go home. So that way, to some extent, we're ensuring that they're at least hopefully starting their treatment.
Now y'all have eyes, y'all have skin, y'all have psychiatrists, medications, pharmacy. And that's hard when you have no income and you come to Hope. Getting your medications, it's great. It's like going to like my Mayo Clinic. When you come in here, you can see all these doctors in one location, and that you feel comfortable. I feel comfortable in.
I'm the missional living pastor at Valleydale Church, which is just down the road from the Community of Hope. And one of the things that we had a vision for was a medical clinic for the Hispanic community, and reached out to Justin, just hit it off with him really well, loved what he was about, loved his vision for this clinic, the vision here is to care for them physically. Obviously, that's the priority here, but also at the same time is caring and loving on them, in a spiritual way, the way that we see Jesus do it in Scriptures.
It's been really exciting to see how God has provided the resources for CHHC to grow and expand services from the small room at the health department all the way to the beautiful clinic we have now and even the mobile clinic. And so I'm just really excited to be a part of what God is doing here to help meet the healthcare needs in our community.
The medical side is in disease and all that stuff. That was really a priority for Jesus in his ministry, and so why would we not as churches want to be a part of that? And there's not a lot out there that's doing that, at least in this area, and so that's why we chose to really work closely with the clinic here, is because of what they're doing.
There's lots of opportunities for people to, whether it's financially or not, that they can come into the clinic and they can support what we do and support their community by doing that.
We're looking for board members, we're looking for medical providers, we're looking for non-clinical people. There's a lot of stuff that can be done here at the Community of Hope.
Giving can come in many ways and forms. Sometimes it can look like a generous check. Other times it could be lending your skills, giving your time, advocating, or just simply sharing a kind word.
When you give to the clinic, you are affecting someone less fortunate in a positive way.
Anybody can get involved. So maybe you can't do a whole lot, maybe that's your situation, but you can give. That's an easy thing to do, is just to give, and you can do that by contacting the clinic, contacting Justin. You can go to the website, and there's ways to donate there. So yeah, giving is easy.
We're a business that doesn't make money, but we operate like a business. We provide a service, and we have to ensure that what we do it well. Everyone being on the same page in terms of that's what we're all here to do is what has allowed our clinic to be as successful as it has been.
Why should you give?
To help others.
My faith tells me to.
On principle.
To make a difference.
To help my community.
Because it's the right thing to do.
You never know who will be affected by your actions.
Because I was asked. For more information on ways to give to the Community of Hope Health Clinic, you can go to www.communityofhopeclinic.com.